Hello, everyone. Dr. Meredith Hayes here. What if I told you that just 2 minutes of a specific massage technique, done at home, could give you stronger, longer-lasting erections, naturally, without medications, and starting tonight? I know it sounds incredible, but this technique is based on principles of pelvic floor therapy and circulation science that urologists have been using for years. If you're a man over 60 and you've noticed that your erections aren't what they used to be, stay with me. By the end of this video, you'll have a simple, proven method that you can start using immediately. This isn't just about quick fixes, it's about reclaiming your core physiological strength. Let's dive in. Erectile strength and duration depend on two main factors: blood flow and muscle tone. Most men focus only on blood flow, and yes, that's important. But what many don't realize is that the muscles of your pelvic floor play a crucial role in maintaining erections. The pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles, act like a pump. They contract and clamp down, trapping blood in the erectile chambers, the corpora cavernosa, effectively keeping the penis firm during arousal. This function is often referred to as the erection pump or the PC muscle. As we age, or due to prolonged sitting, these muscles can weaken, become tight, or simply lose their neurological responsiveness, just like any other muscle in the body, leading to softer erections that don't last as long, or even issues with ejaculation control. The good news? You can strengthen and reactivate these critical muscles and nerves with a targeted massage technique that takes just 2 minutes a day. This isn't some unproven folk remedy, this is based on real pelvic floor therapy principles used by physical therapists and urologists to treat various forms of male pelvic dysfunction. In this video, I'm going to teach you the exact technique, step by step, which you can do in the privacy of your own home. I'll also explain the deeper science behind why it works, emphasizing the role of the pubococcygeus muscle, so you understand what's happening in your body. Knowledge is power, gentlemen. Let's reclaim yours. This massage technique targets the perineum, the area between your scrotum and your anus. This might sound unusual, but hear me out. This small area is packed with nerves and muscles that are directly connected to your erectile function. Why the perineum? The perineum is essentially the surface area where the entire pelvic floor muscle group, including the vital PC muscle, is anchored. By massaging this area, you're accomplishing 3 things. You're stimulating these deep support muscles, you're increasing direct, localized blood flow, and you're activating the complex nerve pathways that govern erection and orgasm. You're also releasing chronic tension that might be blocking circulation, a common issue for men who sit for long periods. Let me walk you through the precise, 5-step technique. Step 1. Create the optimal environment. You can do this massage lying down on your back with your knees bent, or sitting comfortably on the edge of a bed or chair. Crucially, your hips should be relaxed and slightly elevated if possible. Make sure you're relaxed, your hands are clean, and you have privacy. This is your dedicated time to focus on your internal health. You may use a small amount of a natural lubricant or oil to reduce friction, but it's not strictly necessary. Step 2. Locate the target zone, the perineum. The perineum is the soft, flat area of tissue between the base of your scrotum and your anus. Place your index and middle fingers on this spot. If you press lightly, you should feel a soft, muscular area. This is your primary target. Step 3. Apply firm, rhythmic pressure. Press down gently but firmly with your fingers. Think of pressing deep into the muscle, not just rubbing the surface. You're not trying to cause pain, but you should feel definite, deep pressure. Now, begin to massage in a rhythmic, pulsing motion. Press and release, about once per second. This pulsing action is critical because it mimics the action of a pump, pushing stagnation out and drawing fresh blood in. Do this rhythmic pulsing for the first 60 seconds. Step 4. Switch to broad, circular motion after 60 seconds of pulsing. Switch to a different type of stimulation, the circular massage. Using the same 2 fingers, make slow, broad, firm circles on the perineum for the next 60 seconds. Alternate between clockwise and counterclockwise. The circular motion helps to release deep-seated myofascial tension and further stimulates the vascular network in the entire region. This dual approach of pulsing and circular motion ensures maximum effectiveness. Step 5. Integrate deep diaphragmatic breathing throughout the entire 2 minutes. Focus on your breath. Breathe deeply into your diaphragm. Your belly should rise, not just your chest. Inhale slowly for 4 counts, hold the air gently for 4, and exhale completely for 6. This deep breathing enhances the relaxation response and directly increases oxygenated blood flow throughout the body, maximizing the benefit of the massage. That's it, 2 minutes total. Simple, but incredibly effective when done consistently. Visual. Dr. Hayes demonstrates the technique using a diagram or model. Now, let's talk about the science and the results. Targeting the PC muscle, this massage directly sensitizes the pubococcygeus (PC) muscle, which runs from your pubic bone to your tailbone. The PC muscle is the control valve for blood flow during arousal. Massaging the perineum wakes it up and improves its resting tone, making it more responsive when you need it to contract and sustain firmness. Optimizing blood flow, vascularization. The perineum sits directly above major arteries that feed the penis. The rhythmic pressure acts like a physical therapist's drainage technique, preventing venous pooling and ensuring a fresh, strong surge of arterial blood is available for erection. Pudendal nerve stimulation. The perineum is rich in nerve endings connected to the pudendal nerve, which controls sensation and function in the genital area. Stimulating this area sends strong, positive signals to your central nervous system, enhancing both the sexual response and sensitivity. The posture connection. Chronic poor posture, especially prolonged slouching, tightens the pelvic floor and can impede blood flow. This massage directly counteracts that stiffness by promoting muscle elasticity in the region. Massage versus Kegels. While Kegel exercises strengthen the pelvic floor through contraction, the perineal massage releases tension and improves blood flow and neurological awareness. They are complementary, not competing. After your 2-minute massage, I highly recommend performing 10 to 15 slow, strong Kegel contractions. Squeeze the muscles you would use to stop urinating midstream, hold for 3 to 5 seconds, then fully relax. This combination, release, then strengthen, is the 1-2 punch that dramatically improves results. When will you see results? Some men feel a difference in sensitivity or firmness the very first time, especially if the issue was tension-related. However, to see significant, lasting improvements in the strength and duration of your erections, you need consistency, daily practice for 4 to 6 weeks. The key is to make this non-negotiable part of your daily health routine. Let's recap. The 2-minute perineal massage, 60 seconds of rhythmic pulsing, 60 seconds of circular motion, combined with deep, diaphragmatic breathing. Do this daily, and you're giving your body the tools it needs to produce stronger, longer-lasting erections naturally. Gentlemen, your sexual health is not something you have to accept as just part of aging. With the right techniques and knowledge, you can maintain, and even improve, your performance well into your later years. You have more control than you think. Take these 2 minutes for yourself every day. Your body will thank you, and so will your partner. If this evidence-based technique resonates with you, give this video a like and share it with a friend who might benefit. Subscribe to my channel for more evidence-based health advice for men over 50. And tell me in the comments, will you commit to trying this for the next 30 days? I'd love to hear about your progress and the results you see. Remember, you're not alone in this journey. Let's support each other. Thank you for watching. This content is for educational purposes only and does not replace professional medical advice. Consult your healthcare provider before starting any new health regimen.